Not all headache are the same. A patient may say, I have sinus headache, another one may avoid light, and then another may pace with eye pain. So these are different headache with different treatments. Hi everyone, I'm Beatrice. In this video, we'll look at headache. So we'll look at the types of headache, the causes, the signs and symptoms, the treatment/management. So if you're ready for today's video, let's begin. So what is headache? Headache occurs when brain-sensitive structures around the head are stimulated. These structures include blood vessels, nerves, especially the trigeminal nerve, that's the cranial nerve 5, that provides sensory input to pain, touch, and pressure. Also, the muscles of the head and the neck, and the covering of the brain, that's the meninges. Now, according to the International Classification of Headache Disorder 3, headache can be either primary or secondary. So when we say primary, that means the focus of treatment is the headache itself. Or secondary, that means the headache is linked to another cause. For instance, it can be infection, it can be head injury, or any other thing that is causing the headache. Now, according to the ICHD-3, primary headache can be classified as either migraine, tension headache, or cluster headache. Now, first, migraine. Migraine is a neuroinflammatory disorder. You can't really link it to a cause, but it involves the brain structures, the structures around the head, especially the nerves, the trigeminal nerve getting excited, and the structures around the head swells and pain chemicals are released. Some of the features that are unique to migraine include, for the pain quality, the patient will describe it as throbbing or pulsating. And it can be either one-sided or both. So what I mean by that is that at times it can begin just only on one side and occur on one side. At times it can occur on both sides. At times too, it can begin on one side and then eventually spread to the other side of the head. Another thing about migraine that is worse with movement. So this patient will complain that when they move, the headache is worse. And again, this headache, because it's a neuroinflammatory disorder, it involves neuro symptoms and GI symptoms. So this patient will manifest things like nausea, vomiting, and neuro symptoms like photophobia, where they are sensitive to light, even phonophobia, they are sensitive to sound. These are the ones that when they have headache, they don't want noise and they don't want light. They just prefer a dark place. And also, migraine can have different phases, up to 3 phases. One is the prodrome phase, where they experience those GI symptoms, fatigue, just the usual symptoms. It begins with that, and it can get to a state of aura. So this can occur in about maybe 25 to 30% of people that experience migraine. During this time, they begin to experience things like flashing light. They become very sensitive to sounds, speech impairment, vertigo, dizziness, temporary loss of vision in one eye. They may experience nausea, vomiting, and finally the headache phase itself. This can last between 4 to 72 hours. Now the next one is tension headache. So this one has to do with the muscles of the head and the scalp becoming overexcited and contract and tightens. So it feels like a band around the head. It affects both sides of the head. Now this results from maybe stress, fatigue, poor posture. Now, some of the features or some of the things that patients may complain about that are unique to tension headache can include dull pressure to throbbing kind of pain. In terms of quality, they can say if they feel like a dull pressure around the head, it can also be throbbing. Now, this headache, like I mentioned, is both-sided, so it feels like a tight band around the head. And again, it can be mild to moderate. But in this one, in tension headache, there's no GI symptom, there's no neuro symptom. So they won't experience that nausea, vomiting, or that photosensitivity and vertigo that occurs with migraine. And then we have cluster headache. For cluster headache is a hypothalamic dysfunction. So it involves the hypothalamus, also the trigeminal nerve is involved, and autonomic nervous system. So the nose and the eye symptoms are linked to the autonomic nervous system. Now we call it cluster headache because it occurs in clusters. It occurs severally. In 24 hours, the patient can experience it many times. Now, the features that you need to cluster headache include sharp and stabbing pain. Patient will experience this pain on one side. So take note, for migraine, it can be one or both sides. For tension, it's always both sides. For cluster, it's always one-sided. And it can be extremely severe. So cluster headache is extremely severe. Unlike the tension headache that can be mild to moderate, for migraine can be moderate to severe. But this one is always extremely severe. Now, on the one affected side, that side of the face that is affected, the eye will appear red on one eye, and that eye will be teary. The nose, the part of the face that is affected, that nose will feel congested. The patient will experience runny nose, and they will be sweating on one part of the face. The patient may experience drooling of the eyelid on that particular side of the face that is affected. And also, this patient will feel restless. You see them pacing, they are restless because of the way it comes is so severe. Now, let's look at the treatment and prevention for both migraine, tension headache, and cluster headache. So, first, let's look at the treatment for migraine. For that, we'll consider first line treatment like hydration, tell the patient to rest, and try to reduce those sensory stimulation. Can help them to maybe encourage them to stay in a calm place, in a dark room, just to reduce that sensation. At the same time, we use medication like NSAIDs, non-steroidal anti-inflammatory drugs like ibuprofen, naproxen, and Tylenol. They may benefit from Tylenol, that's acetaminophen. And also, there's a medication specific to migraine. We call it triptans, or we call it sumatriptans. It's used for migraine. At the same time, we also treat those nausea, those GI symptoms, like with antiemetics like domperidone, metoclopramide. And again, we have some preventive measures too, medication to prevent migraine from occurring often, because when migraine occur more than 15 times in 3 consecutive months, we call it chronic migraine. So to prevent that reoccurrence, there are some medication that can be prescribed to reduce it. For the prevention, medication like beta blocker, it restricts cerebral blood flow. Medication like metoprolol, propranolol. We also use medication like anticonvulsant, like topiramate. So this one helps to decrease that brain hypersensitivity. We also use antidepressant like amitriptyline. So the essence of this one is to increase serotonin level. Now there's also a medication that we call it CGRP inhibitors. This medication we call it GPANT, also used for migraine. Now for tension headache, the treatment can just be with acetaminophen, which is Tylenol, NSAIDs like ibuprofen, naproxen. They are enough, even aspirin, they are enough to take care of tension headache. But if it's chronic, to prevent it, make sure you work on stress, reduce bad posture. You can go for massage therapy, and also medication like SSRI, also antidepressant like amitriptyline can be prescribed for chronic cases. And then for cluster headache, for the treatment, the first line treatment in acute attack is 100% oxygen. The purpose is to cause constriction of the cerebral blood vessels, because in headache, the dilation of those cerebral blood vessels. So their oxygen will help to constrict it. Also, sumatriptan is also a medication used in treating cluster headache, just like in migraine headache. At times, they can give this as injection. For prevention of cluster headache, because of patients that are having it occurring over and over, they can prescribe medication like steroids, verapamil, which is a calcium channel blocker, and also at times they can prescribe lithium. So that wraps up today's topic on headache. If you find this video helpful, please like, share, leave your comment, and subscribe for more educational videos. Thanks for watching.